will be assessing your client using the Glasgow Coma Scale, or GCS. This evaluates the client's level of consciousness and overall state of their nervous system. The responses are scored from 1 to 4 for eye opening, 1 to 6 for motor movement, and 1 to 5 for verbal communication. The sum of these three scores will create a combined total score of 3 to 15, with 15 being normal. An initial score of less than 5 is associated with an 80% chance of being in a lasting vegetative state or death. An initial score of greater than 11 is associated with a 90% chance of recovery. This scale will determine which individuals need emergent medical attention and what level of consciousness they are functioning at. The GCS is one of the most utilized tools in trauma care. It can also be administered in pre-hospital settings and initial arrival at the emergency department. The age ranges for the GCS are from 13 to 65 and older, in conditions such as comatose patients, TBI, stroke, infection, seizures, non-traumatic comas, overdoses, and even poisonings. Today, my client is Allison, who's a 23-year-old female. She has recently been admitted to the ICU at Broward Health after suffering a traumatic brain injury. She was riding on the back of her boyfriend's motorcycle on I-95 while the motorcycle crashed into an SUV. Today, we will be doing our occupational therapy evaluation on her, utilizing the Glasgow Coma Scale to assess her state of consciousness. Hello, I am your occupational therapist today. I'm just going to wash my hands real quick. My name is Ansu, and I will be leading your occupational therapy evaluation today. So we haven't had any occupational therapy services before with you, Allison, so we are going to just explain what we do here. So in occupational therapy, we're going to help you engage in your daily activities as independently as you can and get back to doing the things you love. So in this situation, we may work on a lot of positioning and just making sure you're comfortable, engaging in self-care routines, eating well, and whatever you need assistance with. So how does that sound? Are you in any pain today? Okay, and have you taken any medications? Okay, so today I will be administering the Glasgow Coma Scale. This assessment is going to measure your eye opening, your movement, and your communication responses. And it's a quick assessment for me to determine your level of consciousness and what we need to work on together. All right, are you ready? All right. So I'm going to have you answer 3 questions for me. What is your name?
Allie.
Okay, and where are you?
The hospital.
Okay, and what month is it?
January.
Okay. So now I'm going to have you do a couple of movement responses for me. So are you able to grab my arm? Okay. So I'm going to apply a little bit of pressure over here, so you might feel a little pinch. Okay, and now I'm going to apply a little bit of pressure over here. Okay. Alright, so that was the whole assessment, Allie. So I'm just going to go over your assessment results with you. So in the first section of eye opening, your eyes were open and you were able to spontaneously blink your eyes, which is great. You scored a 4 out of 4 for that. For your movement responses, you did struggle to follow the simple command of grabbing my hand, but your arm was able to respond to the pressure that I placed in your eyebrows, so I'm going to give you a 5 out of 6 for that, since you were able to localize pain. And then for your communication responses, I'm going to give you a 5 out of 5 because you were able to converse with me and you were oriented in knowing where you were, who you are, and what month it is.
So that's great. So I'm going to use the assessment results to plan our future occupational therapy treatment sessions to work on important activities for you and to engage you in these activities in a way that's going to promote your well-being here. So I look forward to working with you again, Allie.
So now we will go on to explain the interpretation of scores for Allison's performance on the Glasgow Coma scale. For the first section of eye opening, the client scored spontaneous because her eyes were open before I even walked in the room and she was continuously blinking during the assessment. This means she scored a 4 out of 4. For the second section of motor responses, the client was not able to follow a simple 2-step demand, peripheral stimulus test of grabbing and releasing my hand. I had also asked her to open her mouth and stick out her tongue, as this was not shown in the video, but she was not able to do this either. So to determine the motor score, we had to perform an additional central stimulus test. The first being the trapezius pinch for 10 seconds, and the client did not respond to this. So then I utilized my thumb to apply pressure to the supraorbital notch above her eye. This time she was able to provide me a response of localizing pain since her arm moved in an attempt to remove the pressure I had applied. This gives her a score of 5 out of 6 since she was able to localize pain. As for their verbal response, the client was oriented and communicated for accurate answers to the questions I provided about her name, location, and current month. Thereby, her score was a 5 out of 5 for communication. This gives her a total sum of scores 14 out of 15 for the Glasgow Coma scale, classifying TBIs as mild if they fall within the 14 to 15 range. Thereby, Allison has a mild TBI and would benefit from further assessments and evaluation to determine the proper occupational therapy treatment and intervention approaches that are suitable and would be best for her.